Impacted canines are one of the most common orthodontic problems that get completely missed until it's too late. And by the time that most families find out, what could have been a simple fix turns into surgery and a much more complicated case. And the frustrating part is this: in many of these cases, the warning signs were there years and years earlier. I'm Dr. Eric Strouse, an orthodontist in Spring Hill in Lecanto, Florida. And in this video, I'm going to break down exactly what impacted canines are, why they happen, and how to catch them early so your child doesn't end up needing surgery down the road. Here's something that I see all the time in my practice. A patient that will come in at age 13, 14, even 15 years old, and they still have their baby canines. The permanent canine, the adult tooth, is still stuck in the bone. Now at that point, we're not talking about simple orthodontics anymore. We're talking about surgery, braces or aligners to pull the tooth into place with a longer treatment, more visits, and more cost. And parents almost always say the same thing, and that's that no one ever told them that there was a problem. And that's the part that should not be happening. Now the canine is one of the most important teeth in your mouth. It's that pointy vampire tooth, and it plays a very major role in your smile and how your front teeth transition to your back teeth aesthetically. Normally, the adult canine develops in the bone and follows a path to come down into the mouth. As it comes in, it resorbs the root of the baby canine. That baby tooth will get loose and fall out, and the adult tooth will take its place. That's how things are supposed to work. Now, an impacted canine is when that process breaks down. The adult canine will come off path, become stuck in the bone, and does not come into position on its own. Because that's not coming down properly, it often doesn't resorb the baby tooth's root. So what happens is that the baby tooth stays there. That's usually what families notice first, and they start wondering, why is that baby tooth still there and why is it not falling out? But what they don't see is the real issue, and that's that the adult canine is stuck up in the bone and is off track. Impacted canines occur in about 1 to 3% of the population, making them one of the most commonly impacted teeth besides the wisdom teeth. Impacted canines don't just happen randomly. There are real developmental reasons behind it. One of those is genetics. These impacted canines can absolutely run in families. If a parent had impacted canines or eruption issues, the child is definitely at a higher risk. Another one is the eruption path. Upper canines develop high up in the jaw and have one of the longest, most complex eruption paths of any tooth. They have a very long distance to travel and navigation of other teeth to get into. If they drift even slightly off course early on, they can end up completely off track and become stuck in the bone later on. Another is space and jaw development. If the upper jaw is small, or if there's significant crowding with the small jaw, there may not be enough room for the canines to come in. And when there's no space, that tooth doesn't just disappear, it gets displaced, often into the palate or trapped in the bone. Another one is guidance issues. The canine relies very heavily on the lateral incisor, the tooth in front of it, to guide the canine into position. Now, the lateral incisor can often be small or missing or not positioned properly, and when those situations occur, the canine actually loses its guide tooth and can drift in the wrong direction and become stuck in the bone. So these are not random things. They are developmental issues, and they often show very early signs, if you know what to look for. Now, a question that many have is, can these be prevented? And the answer is sometimes yes and sometimes no. But when it can be helped, timing is everything. There's a classic research study by 2 orthodontists named Erickson and Curall that show that removing baby canines at the right time can actually help guide the permanent canines into position. In some cases, orthodontists will actually use expanders to widen the top jaw, or even early orthodontic treatment to create space and improve the eruption path. The goal is to create the right environment so the teeth can come in naturally. But here's the key. It can only work if it's caught early. If you miss that window, those simpler options are no longer available. Now, if it's not caught early, treatment becomes a much more involved case. What you're looking at is a surgical exposure of the tooth with orthodontics to pull it into place. These treatments are much longer in terms of their treatment time. They have more visits, higher cost, and more discomfort for the patient. And these cases are much more challenging. They're less predictable than simple orthodontic cases. In some situations, the impacted canine can even damage the roots of other nearby teeth. That is why early diagnosis is so important. Now, I'm going to be very clear here, but also fair. Dentists and pediatric dentists are absolutely essential for dental health. They handle your cleanings, your cavities, and your overall dental health, but they are not orthodontic specialists. Orthodontists go through additional years of training focused specifically on tooth movement, eruption patterns, and jaw development. And what I see far too often is this. Parents bring up concerns and they're told to wait by their general dentist or their pediatric dentist. They're told that everything looks fine, or the issue just isn't addressed at all. And that's not because anyone is trying to do the wrong thing, but because these dentists and pediatric dentists are just not trained to diagnose these problems in the way that an orthodontist is. And if you're not looking specifically for impacted teeth, you can very easily miss them. And the reality is this. Referring a patient out to an orthodontist does not directly benefit the general dentist or the pediatric dentist. So sometimes those conversations don't happen as early or often as they should. Parents trust the advice that they're given by their dentist and they end up waiting, but by the time they get to see an orthodontist, that problem has often progressed. So as a parent, what should you do? Most importantly, you do not need a referral to see an orthodontist. The American Association of Orthodontists recommends an evaluation for all children by the age of 7. That visit is usually quick, easy, and very often free. And it does not mean that your child will need braces. It does not mean that your child needs braces. It means that the orthodontist can evaluate development, check the growth, and identify any early problems. And if everything looks good and is normal at that time, we'll tell you just that. But if there's something that needs to be watched, we'll monitor it. And if there's something that needs early treatment, we'll be able to guide you on the correct timing and the correct treatment. That one visit can be the difference between a simple and early solution or a complex case that involves surgery later down the road. Now, impacted canines are not rare, and they're not always preventable, but they are very often detectable early. And when they are caught early, the treatment is simpler, faster, and more predictable. But when they're missed, everything becomes much harder.